Okay. All right. So how does your appointment as a new patient experience or as a recurring patient differ from other offices, you think?
Well, I think we all have the same goals as dentists. Where we distinguish ourselves is by spending the appropriate amount of time. We do believe in something called comprehensive care, and to do that, it's more than see a problem, fix a problem attitude. So in our initial exam, we really spend a lot of time. We set aside 2 hours for it. And we go through, we take our photographs, we take radiographs, and we look at every single aspect of your oral health. We take a look at your jaw joints, we take a look at soft tissues in the mouth, neck, and throat, an oral cancer screening. We list everything that's been done over the years and what may need to be done going forward.
Very thorough.
Our whole goal is to come up with a plan that you can follow, not just for the next 6 months or a year, but for life, that helps reduce your risk in 4 main dental categories, with the goal being if you follow these, you have the highest likelihood of being able to keep your teeth for life, which really
we
should
talked
be
about
our goal.
teeth for life a few times, which I liked, because I hope I keep these teeth
Yeah.
for life.
That's right.
So what makes your office so unique besides, I mean, I love the aesthetic of it, the design and all of that. Are there other aspects that you feel make it unique?
Well, sure. I love my team. Everybody here puts the patient first. We're not trying to see 1,000 patients a day. We want everybody here to feel like they are being taken care of personally. It's personalized care.
Okay.
It's not one size fits all. Everybody has different needs and wants in life, and our job is to facilitate that for each and every patient. So
it was cool to, when you say personalization, that you stepped through each piece of my mouth, like with me, and visually I could see it instead of you just talking about it. I liked the visual representation of it. It was
there's
cool.
big broad categories that fit everybody, but how you fit into that category and what it truly means for you is individualized. Your care is going to be different than my care. It's going to be different than your husband's, your kids. So everybody gets their own plan, and there's a right level of care that's for everybody. So we really want to dive into that. And our goal is to meet your goals. It sounds like a strange question, but I always want to know what somebody's goal in coming to the dentist is. You ask people and they go, I don't know, I've never thought about that before. Just here for a cleaning.
Deeper than that,
But after a couple hours with me, you said it on the way out, I'm 35 and I just learned something new, which didn't seem possible.
Didn't.
From the
I
strange,
know everything at 35.
but from the strange thing of everybody knows they're supposed to brush and floss. But most people have simply never even been taught how to do it correctly.
Right. I'm like, I've been doing this wrong for 35 years.
So we start with that very basic level, because my goal isn't a whole bunch of care for everybody. I'd rather everybody be in the preventive side of things.
Right. Have the right tools and knowledge.
Have the right tools and knowledge to stay on the preventive side of life, and you're going to be happier, and I'll be happier for you.
Yeah, I like that. What's the biggest feeling or feelings that you want patients to have after their appointment?
As odd as it sounds, most people are pretty happy when they're done here. Everybody, I don't want to be the one where they go, I hate the dentist.
Yeah.
I understand not liking the procedure or things like that, but even in that realm of things, we do everything we can to make the experience as best as possible. Like you said, from the aesthetic of the office, staring out even the window, we have a nice garden that can be calming there.
Right.
But we really like to have the best technology available for patients, make sure that we're doing everything possible to make sure that their experience is great, and that when we do work for someone, we want to make sure that it's something that lasts. It's not a short-term fix. So when we do treatment, we keep in mind, I define conservative treatment as treating you the fewest times possible over your life. I don't want to put a filling in that's going to last 2 years if that's not the right treatment course or the best treatment course. Unless, of course, that's a decision that we make together, that we're just buying some time. Then, as long as we're on the same page, we're okay with things.
Cool. What standards create the first-class service, 5-star care that you guys have as your mantra?
That every patient needs to be happy. Which is lofty, I suppose. Not everybody's always happy. A lot of times when you go to the dentist, you're not getting the news that you want. It's rare that people...
But it's cool that you guys take the time. What I felt is that you really took the time which showed how much you cared. There's a deeper care for everything going on in here.
I like to do something called co-diagnosis, which involves patients. We take a lot of photographs, both with a traditional camera, but also intraoral camera, that allows us to put a tooth or a scenario up and look at it together. And oftentimes, I'm not the one that is pointing out the problem. It's the patient saying, well, what is that? And how do I get that out of my mouth? It's funny. Nobody really knows what's in their mouth until you put it in front of them.
But it's almost, it's cool. It's like, you sometimes if you hear a doctor say something, you wonder if you believe it sometimes. I think, I don't know, you trust your doctors, but I think what was really neat is that I could see it with my own eyes. You're not just telling me something. I can visually see.
We're getting to the same page together.
Yeah, that was neat.
I truly believe, like I told you through the process, I encourage questions, because without a full understanding of what's going on, it's impossible to make a good decision. So every step of the way, I want that. And it's not just myself that I encourage the questions with, it's with my assistant. Like, obviously he's been out in the world and seen other offices and how things are, and I can give you an honest opinion of where things lie. And Chris up front has been in the business for 30 years. She really knows what's going on, and there's a financial component to this. Our job is to help you see the value in idealized care, and yes, it costs money. There's no denying that ideal things cost money, but it doesn't cost as much as what people would think. And when we talk about the concept of teeth for life, if we kind of amortize out that cost over the course of your life, if you can have your tooth and use it for the next 60, 70 years,
it's worth the investment.
And you kind of think about it in a different manner. So I think that the team is what really helps us with that approach. But part of the team isn't just us; it's involving the patient and bringing them to be part of the team as well.
Oh, cool. And then 3 words that describe your dental practice.
Caring, technology driven, I guess. I don't know how best to say that, but using the best materials and techniques, and then relationships, relationship based. Like you said, it's much different having a true relationship with your provider. Over the course of years, it facilitates a level of trust and familiarity and
comfort,
all those good things. But that's really what got me into dentistry, was that relationship side of things. My dad was a dentist, and I grew up, and one of the neatest things was that there were families with 3 or 4 generations of people that were there, and he'd known patients he just retired at 45 years, and that he worked, and he had patients that were with him the entire time of that. And that's, I don't know, that's pretty cool to be able to serve somebody that long, and take care of them for that long. It's a great feeling to know that we're able to help.
Provide that. Cool. Awesome.